at ejaculation has to be analyzed in the lab to see the density of the sperms, to see the structure of the sperms, to see how the sperms are moving, and we can do some extra tests to assess the ability of those sperms to fertilize.
Okay.
So that has to be done in the hospital.
Okay.
But you can look at telltale evidence in yourself to see if there could be some problem. For example, if your testicle size is reduced, you can palpate in the scrotum and see that the testicles are smaller, or maybe they are softer by yourself, or they are painful when you touch. So those are signs.
Those are small indicators.
Yes, small indicators. Some people, their testes never descended. You know, by design, our testes are formed from inside the abdomen.
Okay.
And then they move out and enter the scrotum. So in an adult, you find the testes, the normal position should be in the scrotum. But you find in some people, the testes are not there in the scrotum because they got trapped on the way.
Okay.
Yes, what we call undescended testes.
Okay.
And so it's important for the parents to examine their male children
when they're still young.
When they're still very young, very, very early.
Okay.
But also it's important for the health workers who look after these children. When the child comes for pneumia or malaria, you examine the whole child.
The whole body.
The whole body.
You don't only take a test for malaria.
Just don't do that. Don't care for the child on a pain. Just, okay, mother, what's the problem? You just write test. No. You have to examine this baby because you might be the savior of this baby's future.
Thank you so much.
Yep.
We are talking about infertility, and doctor is trying to explain to us into details the common factors that causes a lot of infertility among men and women, and then also into the young little children. Doctor is still talking about you being very keen, especially the caretakers of the children. Check the child where possible. You can be part of us in the next coming minutes by sending your messages on WhatsApp on 0786 050 762, and the doctor will be able to reply you and respond back to your queries. You can as well give us a call when that time comes. We are still talking about infertility, and it is Medical Mind. Doctor, what are there some examinations that someone can take to find out if they have blocked tubes, or to find out if they can't function well, or if they are infertile? Yeah,
so usually when a couple has an issue with the conceiving, the first thing is we have to identify the underlying cause. This is a must before even you give any treatment.
Okay.
Now, for pregnancy to occur, at the basics, 4 things must be in order.
Okay.
1, there must be sperms. 2, there must be eggs. 3, the tubes must be open because the sperm and the egg meet in the tube, as I illustrated. And finally, the womb must be fine. So these 4 things must be okay and working well. So if a couple has any issue with conceiving and they're not getting a pregnancy, those questions must be answered. So these questions are answered through tests. Yes. So 1, how do we know that the eggs are okay? For the woman, to know that for us to know that the woman's eggs are okay, 1, you look at her age, because this is one of the commonest factors. If you see the woman is within the productive age, that's a tick. But then you look at
the productive age is 18 to.
Oh yes, that's good. Within the age of 18, actually from as low as 15, but between 18 between 18 to 35, that will still be considered a good age.
Okay.
Yes, but then also her periods, you have to see if the periods are coming regularly and she's not missing a period, that's a good thing. But you must confirm the situation of the egg with hormones.
Okay.
There are specific hormones which tell you that yes, the eggs are enough and they are of good quality.
Okay.
Yes, we do those hormone tests. So that is for the egg. Then for the tube, the most used test is what we call the HSG. It is the X-ray test for the tube. That X-ray test for the tube, which we saw on the images, it will show you what the normal tube is like. It will show you what the abnormal tube is like.
Okay.
Now, for the womb, the examination of the womb needs a scan,
Okay.
an ultrasound scan. There are different problems of the womb which may show up, and so it will be seen on the scan. Okay, the ultrasound scan, we can see a normal ultrasound scan image. Let's have a look at it.
Okay.
This is just the structure for the womb.
Okay.
Can we have the one for the scan, normal ultrasound scan for the womb? Normal scan, yes. So when we do the scan, this is how a normal womb will look like.
Okay.
Nice. This is the muscle, and this is the lining inside. So this is how it will look like. Very simple to see. Even the doctor can show you when they are doing the scan. Yes. For example, some abdominal cysts can be like the fibroids. Maybe we can have a picture of the fibroids. And oh yes, I hope this is a little bit is clear. Yes, I think so. So if you see the difference. The previous one was nice,
so
it was
clear.
all looking like that.
Yes.
But now we have a ball here. This is the ball.
That is a cyst. Is it a cyst?
No, this is a fibroid.
A fibroid,
yes,
that has developed in the womb.
Yes.
Oh,
so such may be one of the problems with the womb. Yes. So this is what the scan shows you. And by just this simple test, which is available almost everywhere, you're able to tell that the womb has a problem or it has no problems. And in some centers like ours, we're able to evaluate this further and see the relationship between this fibroid and the cavity of the inside. So we have some additional modification of this test. What we call the sonohysterogram, where we put in some fluid and you're able to see the edges very well, and you know, oh yeah, this is the, and even it's not magic, the patient can see it for themselves. So this is how you assess the womb.
Okay.
Yes.
Okay.
Yeah, and then
so
for
much.
the tube, we can have a review of the image for the tube, and we see the normal tube. Yeah, so this is the X-ray test for the tube. They appeared here, the tubes, the normal tubes, and spill out like how I said before, and the womb cavity also is seen here. We can have a look at the blocked tube. Yes, so again for the blocked tube, you will see the cavity of the womb is seen. The tube appears but stops somewhere here and stops somewhere here. That indicates the blockages.
Okay.
Yes, so this is how it is done. These are simple tests and they're not very expensive.
Okay.
Yep.
Thank you.
Yep.
Thank you so much, Doctor. Please have a seat.
Yes, so
we are going to have a very short break, and when we return, please feel free to share with us your views, give us your comments, and give us all your questions on 0786 050 762. And Dr. Anabat will be here to give you all the answers that you're needing.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
I thank you for my life.
Ladies and gentlemen, the Nsima Festival has returned. On the 17th of December 2023 at the National Theatre parking lot. Doors open at exactly 10 a.m. with bouncing castles for children, games, performances headlined by Jean-Marie, alongside all your favorite gospel artists. Tickets available at only